and it's wonderful to be here today to be with all of you and share our experiences, how we have seen healthcare innovation in last few years and what kind of trends we are seeing from a healthcare innovation perspective. Of course, more from services side because that's where we have been working and that's the segment we have been operating in and looking at growing. One thing before I start, I think both the speakers spoke about traffic when you entered this place. And me coming from Bangalore felt at home because you're seeing, okay, now you have to cross this road and it will take 20 minutes. Wow, this looks like outer ring road. And you're wondering why everybody cares only about Bangalore traffic actually. I was like, this place looks so familiar. But anyway, luckily my driver was as smart as a Bangalore driver, so he cut in the middle only, he didn't go all the way to the U-turn, and that's why I came on time. So starting with that, I'm looking at, so from a healthcare innovation perspective, we are looking at services, how innovation is playing out. And if you look at our journey as Portea or even in my own experiences, I think a lot of innovations on consumer side or on what we call patient in our context has always been about knowing patient better actually, or knowing the consumer better. And in the last 30, 40 years, whenever we have seen, when we talk of innovation from the beginning, you always say, given the channels, given the technology available, given the data available, how well you know your patient, how well you know your consumer, right? And a lot of innovation which you are seeing in healthcare today are what probably you saw in other industries, whether it was e-commerce, what you see in food delivery and things like that, is probably going to play out a lot more in healthcare because now you have technology and means and channels to know your patient better. I mean, earlier, some time back, nobody wanted to talk about their illnesses, right? If somebody is diabetic, in India especially, we would never talk about it. It would look like something which you didn't want to talk about. Today, I met one of my friends last week, and he is diabetic, and he removed his t-shirt and showed, see, I'm using this CGM from Abbott. And so how cool it is. And he showed me on app how the readings are coming and what is happening and so on and so forth. So now given that you have access to consumers or to patients a lot closer than what you ever had, right? A lot of innovation is coming around how well you know your consumer. I mean, a Zomato or Swiggy knows exactly what you eat, right? What are your food habits, correct? Those kind of things because they have been in touch with you. The data is available, they had access to you. We didn't have that kind of access as far as healthcare was concerned, right? That is something which is getting built right now. And how that is playing out, I just wanted to give a little bit background. If you look at from mega trends in India, right, the connectivity and convergence has moved significantly. I mean, we are the largest mobile phone user in the world now. And look at the number of downloads, app downloads, right? I'll give you a funny incident. One of my friends, she and her daughter were playing. The daughter is 5-year-old. They were playing shopping, right? And he says, okay, the daughter gives her the product and she says, okay, give me the money. She said, oops, I don't have money. So she said, okay, I'll give you the QR code. Okay, this 5-year-old talking, and that's the penetration UPI has had in India, right? And that's the kind of mindset today's consumers and future's consumers and patients are going to have. Second, of course, one is urbanization. We are experiencing that. And this again creates significant focus on what kind of disposable income consumers and patients are going to have. Third, of course, focus on health and wellness. The aging and the NCD burden is very, very high. I have some more data to talk about that. And of course, social trends, because people decision making from a consumer perspective, patient perspective is changing significantly. Now, these are some of the mega trends from a healthcare perspective. We have 300 million expected geriatric population by 2030. That is as big as United States of America today actually. Only the geriatric population will be that big, right? And roughly 2/3 of them will have chronic diseases by 2050, right? So that's again something which is a very, very sizable number, correct? This of course increases the healthcare demand. Chronic diseases already account for 1 in 2 deaths. So people are living longer and of course they're living longer more unhealthy than they lived in the past. And that's why even companies like Portea are probably out there supporting patients for a geriatric population, chronic disease and so on and so forth. But that is something which is going to define how healthcare is going to get used in this country. Here's some other trends. Again, the whole focus is that so many ancillary industries which are coming up along the healthcare and wellness. That's again something which is very, very sizable, whether it's weight loss, whether it's sporting goods, mobile health apps, medical tourism. We're talking of wearable devices, which are like and of course, which are becoming more and more medical grade as we go along, right? And these are some of the trends which are shaping how customers and patients are looking at healthcare, consuming as well as getting engaged from there. And these are some of the consumer mindset changes which we are seeing now. I mean, we had talked about awareness. They are aware and informed, okay, and especially I think after COVID, this whole pace has become much faster, right? So before COVID and during COVID and after COVID, I think consumers have moved to accessing healthcare information online. Of course, consuming healthcare online, which is things like teleconsultation, counseling, and so on and so forth. The acceptance of that has become sizable. Even elderly population in our experience has been a lot more open to saying, can they look at devices? I mean, using devices was not a big thing before that, but people have been a lot more open to that today. And of course, they are also a lot more open to being engaged using digital medium, using online. I think that's probably the biggest revolution, the biggest impact which COVID has made as far as the consumer healthcare is concerned. And of course, this is what I was talking about, the uptake for teleconsultation, uptake for video consultation, e-pharmacy, the healthcare funding. I mean, last couple of years in the US, of course, from a healthcare funding were probably the highest. I think last year US raised almost $22 billion in healthcare funding, right? From a startup perspective, and those kind of solutions are going to be out there in next few years. And of course, digital transformation of pharma industry, that's what I think Vivek was talking about, and that is something which all of you understand better than me. And of course, where all innovation is needed actually, right? So it's needed in access side, cost side, and quality of healthcare, right? We are talking of healthcare information technology, remote diagnosis and management, digital health platforms, of course, especially leveraging mobile, low-cost products and solutions, India-centered innovation, which all of you are driving, of course, which is very critical part of it, and what tools you use to expand talent and skills. And some bit of that we see, of course, from a services perspective now, which we are seeing, whether it's for medical professional, paramedics, and all of that. How do you basically, India as a country also needs probably 3x, 4x of the numbers which are there right now. How do we work with population at large, and what kind of technology innovation we can use to create that kind of workforce for us? Because I mean, the kind of requirement for hospitals and other specialist services side, it's very, very critical to innovate on training and skilling side. So that can help us with the manpower required to run our nation's healthcare going forward. So the big trends which I wanted to talk about, I think that key trends of 2023 and going beyond that, I think usage of AI is something which is significant, given that there are a lot more wearable devices, patients are a lot more open to using it, data is getting utilized, data is getting generated. What do you do with that data, of course? Can you leverage AI? Can you create solutions basis that? The second one is the remote healthcare, home care and telehealth. I think there's enough talk about hospital at home. That is something which is a trending thing in the US. And of course, at some stage will also come to India, saying that what all procedures you can move from hospitals, can that be done at home? Can that be done at remote locations? Can there be virtual wards which you can manage, given the high cost of healthcare delivery, right? The high cost of surgeries and so on and so forth. If it is looking at which all other remote channels which you can use to drive healthcare delivery, and of course home care, which we represent, also is a big part of that, and we are seeing that in the US. Of course, in India also we are seeing acceptances of that lot more. The third one, which is a big trend and will only gain basically pace, is the whole retail healthcare, right? So retail healthcare also, given Amazon and Walmart and everybody talking of getting into healthcare, what do? They all look at primary healthcare. They look at things like vaccination, they look at things like diagnostics, right? And that is something which will start moving from primary care centers. If you look at India as a country, we have very strong primary care network, especially around government public health centers and things like that. Okay, India needs to invest in tertiary care. India also needs probably at the same time to take this whole public health center thing which we are doing primary care. Can we take that to patient homes? Can we take that to more remote locations than what we are doing today? And that's again something which has just started getting there and probably will pick up significant pace. when we were we were talking about COVID, in both COVID wave 1 and wave 2, we did a lot of support along with the government. In fact, the first program of basically COVID isolation at home was created by us along with Delhi government, right, in 2020, right, and that looks like long time back. When we didn't know what were the SOPs and we didn't know anything, and that's the first time government worked on a program saying that, okay, can they work and do home isolation for COVID. And those kind of things are picking up a lot more pace in India now and of course worldwide, and will become the way we operate from a healthcare perspective 5 years, 10 years from now, right? And the other one is wearable medical devices. I think the Internet of Things is what we should talk about in technology sense 10 years back, of how we manage servers, if some of you know virtualization and basically bring your own device kind of model, right, which has become the norm today. What we are looking at medical devices, what is Internet of Medical Things, is how it will look like maybe next 7 to 10 years, right? Because even if you look at devices, wearable devices now, right? Apple watches and so on and so forth, all of those kind of things will become medical grade over a period of time, and that's something which will give access to patient continuous readings and data to us to analyze and work on, and how can we support them with that, right? So that's again something which will pick up significant pace now. And the last one, but not the least, is the whole personalized healthcare. I think that's again something which is a big thing. I think Vaibhav touched upon that, saying that how do you manage a patient's healthcare basis his treatment plan, right? How do you create a personalized treatment plan? And personalized post-treatment support, right, is something which we have been doing. But that's again something people will start looking at how it is customized, tailored to my needs actually, right? And that is possible today because you have access to data. And access to data is there because you have devices which can do continuous monitoring. So I think these are trends which are there in 2023, but I think these are trends which will define how the healthcare market, especially from services perspective, will play out in next 5 to 10 years, and how we as a country and we as an industry should gear up for that. So one area which I picked up just from a pharma perspective, we work with some of you over here, and where we are seeing good innovation and we believe that we could make that work, is the whole patient support program, and how that can become a lot more digital driven, lot more innovative than what has been in the past. Of course, these are some of the data which you know. Of course, the program uptake on patient support programs has not been great. The treatment adherence is not very good, and patient engagement doesn't work very well from a traditional perspective. And how we are looking at transforming that, leveraging innovation of what we talked about. So this is the whole piece, what we are discussing over there, saying that can you look at each of those trends and how can we start using that in the whole patient support, patient education, patient management programs, right? The real-time patient analytics can be done, the feedback can be omni-channel, the data gathering can be through connected devices. We experimented that. There are quite a few companies in the country now which are putting all the basically monitoring devices together on a platform. The companies like Nano Health and Faber and so on and so forth. That's something which is gathering significant momentum, saying that, okay, can you put all the wearable devices, can you put all the point of care devices on a single platform and start collecting patient data? And if you collect that, how well you can use to support your patients for the specific therapy which you are supporting them on. Of course, patient awareness versus using a unified knowledge base and multiple onboarding channels. So, how you get close to the patient? Basically leveraging the point of care devices, leveraging connected devices. You of course collect data, analyze data. Basis analysis of the data, you create personalized treatment plans for them. And how do you engage them after that using that personalization and continuous improvement model, right? The continuous improvement loop can you create and can you close that? I think that is becoming more and more important, and that is something where all these innovation, all these ideas can help you to support your patients a lot more effectively than what probably we could do 3 or 5 years back. This is how it will look like, the engagement piece, screening for a disease, using intelligent devices, the personalized treatment plan creation, end-to-end disease management, using virtual consultation, even treatment models like pulmonary rehab and things like that. Can you create a full treatment plan for that, leveraging virtual physiotherapy and consult, something which can work. And of course, the whole using digital training counseling model to teach staff, to teach cell therapy skills to patients. So again, look at the 360 view of how you manage a patient support program and all the innovation which healthcare services are seeing, how that can be leveraged to support your patients much better. And of course, last but not the least, is when you start working with a patient from a patient engagement perspective, at each stage, the basically patient engagement increases with you, and each stage from a compliance perspective, the follow-ups, the real-time resolution of any medical queries, the real-time monitoring, it really helps you basically in increasing the compliance of the drugs, and of course, increasing the lifetime value for you, for the patient. So that's a summary of how we see the healthcare innovation playing out from a services perspective, and how you could leverage it in your industry, leveraging each of those innovation ideas which we are seeing playing out in next 5 to 10 years. Thank you.